we are not in Beverly Hills. Y'all do understand that, right? All right. Well, now, knock on the door a couple times, put the thing in the door, keep it. It says, beware of dog. Even though you don't see a dog, the dog may be under the house. All right. That means don't go in the fence. Keep it moving. Everybody in the neighborhood is somebody. Alright? They belong to somebody. And as much as I'm saying that to you all, please speak to everybody.
I'm Matt Glover, and
I'm Pam Paul.
And this is Pam Pauls. We co-chair of the Newtown Success Fund. Consistent in what they say. You come in here with these programs, and as soon as they get acclimated and start to work with the program, it's gone. So they have very, very little faith in us sustaining this program.
It's severely impacted by health disparities as it relates to any other race. Any other race. We always end up with the highest numbers, the highest number of deaths, the highest number in disease.
We want to empower you to assist in the survey and focus group development, administration, and the understanding of the information. We don't want to go back into my office, start putting it into our fancy software, and then come back to you and say, this is what you need to do. We want you to help us, and we're going to help you be able to understand what that data means. And then you're going to come up with those recommendations. How do you know what kind of questions to put on a survey? How do you know? You got to get the information from the focus groups. Your focus groups are going to create information that you're going to learn, and then you take that and you construct a survey around it. There is food in the back of the room, so please help yourself. Age groups, everybody's experiences were very different, but yet the issues were very consistent.
Like I say, it was heartfelt. It was the best experience I know that I've had dealing with people.
And I think that is probably some good stuff for one of the other questions. So, okay, we're going to move to the second question. Physicians don't understand my issues.
And lack of compassion, and that was one that we...
Lack of compassion?
Yeah, they treat them like they're a herd of cows, in and out, in and out.
And like he said, he's going to follow, he's going to come with us in the car, and I'm going to be walking the street. If y'all have any problems, if anybody gives y'all any hassle, or if you see anything suspicious or out of the ordinary that you think is kind of crazy, just let me know, because I'll be walking with you. He's going to be in the car behind us. Usually Logan Street first.
So it's going by
The bigger the numbers get, well,
born in my mother's house.
Okay, and you moved out?
And I was gone for 22 years near Stanton when I came back.
such crazy filters right there.
all right, let me get a turnaround. See what they don't want.
One person I had to survey, they said, I don't have time, I had to fix my vacuum cleaner because the wire was cut in half. So I said, I tell you what, get a pair of scissors, I'll fix the wire while you fill out the survey. So I fixed the wire up for him with the scissors and twisted the wire. The only thing I had to do was just tape it, and then they can vacuum the house. But I'm working hard for these surveys.
People weren't as reluctant and hesitant as I thought they were going to be. You know, once you explain to them what we were out here doing.
Right.
And then they open up the doors. The problem was, after you told them that, they wanted to talk a lot. You know, so it's kind of hard to get on over to the next person.
Okay.
But I really think today was successful. You know, we reached our goal. We're getting there.
Okay.
Good. The people are very receptive. I didn't have anybody who turned me down. Like you said, once you get in there, people get you there, and now they want to talk a little bit. And
They got a lot to. They got a lot to say.
On their mind. They have a lot on their mind.
A couple of people, they were like in their cars about to go, they're like, oh, we're getting ready to go. Well, can I get 5 minutes of your time? It won't take long. I'll do it for you. It'll be real quick. We'll go together.
Our first one was an 80-year-old lady. Like I say, if you was talking to her, you would think she was gonna be mean. But once I threw that, oh, you look good to be 80 years old, and she just went on and filled out the thing. But being persistent and tell them, like you say, just give me 5 minutes. I can be through it in 5 minutes. It might take 6, 7 minutes, but 5 minutes.
They were willing to give us information. A little hesitant at first, but then you get in there and start talking. And they were so friendly, and especially if you had something of interest that they were interested in. Like.
Now, the important thing to remember there, correct me if I'm wrong, these are people who took the survey and their reported ages. That's why there's not anybody below 18 on that particular slide.
Okay, employment. Look at the employment. The city's unemployment rate is 12%. This group wants screenings. They want health screenings. And then it levels off. Look at the green, health fairs. It really spikes as you get older. These groups here really like health fairs. And then it drops significantly. 66-year-olds really just don't want anybody telling them what to do. Not your opinion. It's got to be the data. Insurance for children will be great. And men. Insurance for men. Insurance for children.
Emergency room instead of the doctor's office. And I think that's the most important thing to be focused on. Why people are going to this emergency room, and I don't know if we look at the status of who's going, but I think that's the most important, getting that information out, to visit your doctor. Like I said, you were showing that most of them had family doctors, but they still was going to the emergency room, and I think
that's good. And it really boils down to bringing it to them, not expecting them to come to your ivory tower. And so we have to get better at doing that. We've got to meet people in the context of their crisis.